it's Jessica DaMassa with WTF Health, and joining me right now I have Jen Lannon. She is the co-founder of Freeze.Health, which is an app that helps women make decisions about where to freeze their eggs. So Jen, why do we need to disrupt the way women are freezing their eggs? Why is it so important to apply some healthcare innovation to this area?
Totally. So I guess the biggest reason that we started with is because the pricing information about egg freezing is really hard to find. My co-founder and I were both thinking about freezing our eggs, and we went to all of the websites of the different clinics, and I think like 10% of the websites, if that, had any pricing information on the site. And then when we called the clinics, a lot of times they gave us different pricing information than what was on the website. So when we were trying to do this in a cost-conscious manner, first of all, we found that pricing really does vary. For example, in New York, pricing ranges from $4,000 per cycle to $18,000 per cycle. So you can save a lot of money if you know the right questions to ask. And so we started just asking all of these clinics more detailed questions about their pricing and putting it down in a spreadsheet. And we thought that other women might find the same information valuable so that they can do it in a cost-efficient way if they're thinking about doing it.
Okay, so what did you learn? Like, other than like, okay, wow, the price disparity of this, did you learn, like, are there different methods to this? Are women asking the right questions? Like, tell me some of the things that you found out.
How much time do you have? We learned so much. I think one of the most interesting things that we learned is, first of all, the majority of clinics that do egg freezing, the majority of their business comes from IVF and other procedures. So it's couples that are generally later in life, and they're genuinely looking to conceive and create kids, have a family. So the marketing messages of these clinics are so different. And we would go to these clinics for information sessions or to get a tour, and there would be postcards of babies on the wall, and the doctor holding the babies that he helped create. And that's great for people that want to have a family. That's really inspirational. But for people that are thinking about freezing their eggs,
you're not there yet.
We're not there yet. We literally use the hashtag #NoBabiesNow for in our internal communication. So one thing that I think is really interesting is that there are clinics that set up either specific offices, or the entire clinic itself only does egg freezing. So for me and my co-founder, we both went to one of these clinics because it was a really different experience. And I think that's something that's just started happening in the last couple of years. And that's somewhere where the innovation has actually started to come to this and provide a better user experience.
How big of a market is this, Jen?
I'd say it's about $1 billion now. So this year, they're expecting about 75,000 or so women to freeze their eggs.
Okay.
And so at about $10,000 per procedure, plus $2,000 to $5,000 in medications, and then an annual storage fee after that, which is a few $100s, sometimes $1,000, up to $1,500 I've seen. So you're talking about, about $12,000, $1,500. $12,000 or $15,000 for the upfront cost, and then a recurring cost of either a few $100 to $1,000 and change for each woman.
And I mean, it's interesting. So you're bringing price transparency to this. What else are you bringing? Is there advice? Because I mean, if it were me, I would not know step number one other than Google how to freeze your eggs. So okay, and sometimes, I mean, nothing against Google, but you get good stuff, you get bad stuff. So what are you guys doing to help kind of, I guess, shift this market into making it not only informing consumers with price, but informing consumers with information, I guess?
Totally. So the basic way that we're doing that right now is through blog posts. We interview reproductive endocrinologists, which are the doctors that perform this procedure. We interview patients about their experience. And so definitely the informational aspect is one way that we try to just give more transparency to what's going on. There's been a lot of pop media coverage of egg freezing, what's going on.
Why do you think that is?
I think it's because it's such a, I don't know. I think part of it is because the market of it's young millennial women and the types of media that they consume are Pop Sugar and Refinery 29 and those types of things. So because it's something that's affecting their audience, they're writing about it. And it's just kind of a shocking, crazy thing. Everyone wants to talk about it, and now everyone is starting to know someone that has frozen their eggs, which is really, really cool.
It's different, yeah.
But the thing that we found with those media outlets is, it's snippets from this person, it's snippets from that person, and in terms of providing a complete view of what happens, they're not writing a treatment protocol and sharing it with people. They're pulling a few snippets about what's interesting and what's cool, and it helps give women more of an idea, and it helps get them thinking about it. But in terms of deep information on the process and, what do the doctors that perform this say? It's a little bit more limited and not necessarily out there in the mainstream media.
Yeah.
So we're trying to provide a little bit more of the deeper kind of like medical based information around the procedure and also patient experience.
So what are you guys doing next? I understand that you guys are bootstrapping it right now.
Yeah.
You're not looking to raise anything. So what are you looking for? I mean, like, how are you going to scale this out?
Yeah, so we started in 7 cities across the U.S. We're looking for fertility clinics to basically sign up and just verify their pricing. So right now we have pricing that we've kind of reached out to clinics and we've gotten from them. But what we want fertility clinics to do is basically sign up on our site and keep us posted if their pricing changes.
Okay.
So that's one thing. And then obviously women who are thinking about freezing their eggs, we would love them to take a look at the site, let us know if it's helpful. And the next kind of feature we're going to build out is a calendar of events. So a lot of these clinics will do free events for women to learn about egg freezing before they make a decision.
Sure.
Which is great because it's a free way for people to go explore the clinic and help decide where they want to do it. So the next thing that we'll be releasing is a calendar of events for women in different cities.
Very cool. I love that you guys are bringing such visibility to this issue. I think like women's health right now is having a moment, and this is one of those areas that is often ignored completely. So great work.
It's exploding. It's like such an exciting time to be in this space because egg freezing was only approved for general use 6 years ago. And
Which is nuts to me. I feel like it's been around forever.
I know. It has been around, but it's been more for like women that were undergoing cancer treatment and they wanted to preserve fertility because they might have lost it. So this space of like social egg freezing is really interesting. It's an exciting time to be in the space.
Awesome. Well, we look forward to seeing what comes out of this, Jen. Thanks so much for joining us. This is Jessica DaMassa with Jen Lannon of Freeze.Health for WTF Health here at Health 2.0. Thanks so much.